Okay.
Yes.
Okay. Okay, done. I hope it is clear. Audio, video is clear.
Yes, sir.
Yeah, yeah.
Yes, sir. Yes.
So how to interpret the BI-RADS? So if BI-RADS 0 is given, the scan should be repeated. If BI-RADS 1 is there for a breast lump, BI-RADS this mammogram is done. If BI-RADS 1 is there, then it is negative for carcinoma. If BI-RADS 2 is given, it is a benign lesion. It is not carcinoma. It is not cancer. If BI-RADS 3 is given, it is probably a benign, but short-term follow-up. Every 6 months we should follow up. And there is a very low possibility, less than 2% will turn out to be malignant.
Sir, please stop for interrupting you.
Ah,
What is benign malignancy
okay,
and what is carcinoma?
okay, okay.
Okay.
Benign is,
Yeah.
it is not cancer. If there is a lump which is not harmful, that is a benign. Malignant means it is a cancer. So the synonym for cancer or carcinoma is malignant. Benign means it is not cancer. So whenever BI-RADS 2 is given, it is not cancer or carcinoma. If the BI-RADS 3 is given, it is probably benign, but there is a chance of developing carcinoma in 2% of the cases. So follow-up should be done if BI-RADS 3 is given. If BI-RADS 4 is given, it is a suspicious. It may be a carcinoma. Around 2 to 95% of these cases will turn out to be cancers. So if BI-RADS 5 is given, it is a highly suggestive carcinoma. 95%, greater than 95% of them are turn out to be cancers. If BI-RADS 6 is there, already the patient underwent biopsy. It is a known case of carcinoma. Then it is given a BI-RADS 6 and surgical excision. That lump or mastectomy is to be done. So BI-RADS 4, 5, 6. This is where we get the problem. 6 is a proven malignancy. 5 means it is a highly suggestive of malignancy. Then we do the FNAC. We put a needle into the lump, we aspirate the cells, see under the microscope, confirm. So in case of breast carcinoma, triple test is done. The triple test means whenever a doctor palpates the tumor, if it is fixed, if it is hard, and if it is not moving, if the skin or the swelling is puckering of the skin, if there is a pseudo-orange appearance of the skin, if there is a retraction of the nipple is seen, he will put a query and he will say it is carcinoma. He will put a question mark and he will write as carcinoma breast. He will send it to the radiologist. Radiologist will give his opinion, highly suggestive or suspicious of breast carcinoma. Then finally the patient will land up in a pathologist. So the pathologist will put a needle in the breast lesion. He will aspirate the cells, see under the microscope, and he will confirm the diagnosis. If all the three are positive, then it is carcinoma. Then lumpectomy or mastectomy has to be done. Mastectomy means removal of the breast completely along with the bit of skin.
Sir, again, sorry for
Uh,
interrupting you, sir.
yes, yes.
You are going so fast.
Very fast. Sorry. Okay, sorry. Okay. So whenever we
Sudhakar
get,
sir,
okay, I will
yeah,
be a bit slow.
okay.
Whenever
It
BI-RADS,
should be a slow thing. Okay.
okay.
Sorry, sir, for interrupting you
No,
again.
no, no, no. I got
Yeah.
your point because all this thing is done mainly to help our dietitians to interpret the
Mm,
reports. So if their
mm.
BI-RADS report is 1, 2, or 3, then there is no problem. If the BI-RADS report is 1, 2, 3, there is no problem. If the 3 is given, we'll ask them to come for every 6 months. And less than 2% will develop cancers. If BI-RADS 4, 5, 6 is there, 4, 5, 4 means it is a suspicious. Around 2 to 95% of the cases of these lumps will turn out to be malignant. If 5 BI-RADS is given, it is suggestive of malignancy. So usually when a patient presents with a doctor with a lump in the breast, the doctor will examine. He will see whether the lump is firm in consistency or hard in consistency. If it is hard in consistency, it is a doubtful lesion. Along with the hard in consistency, if it is fixed, if it is not moving on palpation, normally the breast lump will be moving. But if it is fixed to the underlying skin or if it is fixed to the muscle, underneath muscle, then it is suspicious because carcinoma will infiltrate into the underlying tissue. So that is where the clinician will diagnose as choriocarcinoma. He will send to the mammogram. mammogram will give either 4 or 5, highly suggestive of malignancy or suspicious. So then the patient will come to the pathologist. The pathologist will put a needle into the tumor, aspirate the cells, observe the cells under the microscope.
Sir,
Yes.
sorry to stop you again. You are going too fast, sir.
Okay, okay.
Okay. What is the muscle? What is the difference between fibroadenoma and a lump?
Okay.
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 Is there a difference?
Okay. Lump is a clinical terminology. Fibroadenoma is a pathological terminology. So a lump can turn out to be a cyst, or it can be fibroadenosis. Whereas a fibroadenoma is a non-malignant tumor. Non-malignant tumor arising in the breast is a fibroadenoma. Whereas a malignant tumor arising from the ductal epithelium is carcinoma or cancer. So the pathologist will finally
Sir, again, stopping you for this, but what is ductal epithelioma and fibroadenoma?
Okay. So from the duct, both are benign. If there is any tumor arising from the ductal epithelial lining, fibroadenoma, it is a biphasic tumor. It is a tumor arising consisting of the ductal epithelium along with the fibrous tissue. So that is a fibroadenoma. It is a non-cancerous condition. So there is the other one is a ductal papilloma. Ductal papilloma is also a benign tumor arising from the ductal epithelial lining. Benign means non-malignant. So ductal papilloma, fibroadenoma, these are non-malignant conditions which can be treated by simple excision. Whereas a malignancy, whereas a carcinoma, it needs wide excision. Sometimes.
Sir, I need to stop you again.
Okay.
I mean, what do you mean by excision?
Excision means removal, simple removal. Removal of the lump, that is excision. Surgery is done where the tumor part is removed, that is excision. So if there is a BIRADS 5, we will diagnose it as on doing fine needle aspiration cytology. The pathologist is the final authority to diagnose the carcinoma. Pathologist will confirm the diagnosis of the clinician and the radiologist. So next, coming to the diet and cancer. So if this is a general topic, how diet helps in cancer patients. So regarding diet, we have three aspects. One is the exogenous carcinogens. Other one is the endogenous synthesis of carcinogens from the dietary components which we take. And the third one is a lack of protective factors. These are the three areas which will lead to carcinoma. So exogenous carcinogens. So aflatoxin, this is found in moldy hay. Aflatoxin is an exogenous carcinogen. It has been shown to be the positive agent of liver cell carcinoma. Aflatoxin is found to be a causative agent of liver cell carcinoma. So the food additives, the artificial sweeteners and contaminating pesticides, there is a debate about, we don't know exactly whether they are causing cancer or not. We don't know exactly. The debate is still going on about the food additives, artificial sweeteners, and contaminating pesticides. Another one is the endogenous synthesis of carcinogens. So gastric carcinoma, the cause of gastric carcinoma is found to be nitrosamines and nitrosamides. Amine is derived from the digested proteins. Amines are derived from the digested proteins. And the nitrate, this component is derived from the preservative sodium nitrate. Sodium nitrate is a preservative. So the sodium nitrate and nitrosamine and nitrosamides, they have been implicated in the etiology of cancer of the stomach. Nitrosamines and nitrosamides. So the colon cancer. So one causative of colon cancer is the intake of high fat intake.
Sir,
Suresh.
I need to stop you again. But what is etiology?
Etiology. Etiology is the what is the cause of the cancer? That is etiology. Etiology means
Mm.
what is the reason behind. So if there is a colon carcinoma, what is the reason? What is the etiology? What is the cause of the colon carcinoma? The cause of colon carcinoma may be high intake of animal fat or lack of fiber in the diet. That may be the cause. So when we take high animal fat is usually digested by the bile acids, bile secreted from the gallbladder. So this high animal fat will act on the bile acids, and this will alter the intestinal flora. The intestinal bacteria are there. These bacteria, uh, they will turn out, they will act on the bile acids, and they will give rise to bile acid metabolites, which are cancer promoting, which will help in the development of carcinoma. So intake of animal fat and lack of fiber in the diet will produce bile acid metabolites, which can turn out to be carcinogens, cancer forming carcinogens. So when there is a high amount of fiber in the diet, the stool bulk is increased. When the bulk of the stool is increased, the transit time, the time between by the duration, the transit time, the intestinal transit time is decreased. So even before the toxins are absorbed, the toxins are excreted when the high fiber intake is there. And not only that, the high fiber will bind to the toxins.
Sir, uh, sorry to
Uh,
stop you again.
mm.
What is called transit time?
A transit time is the period from the time we take the food and uh, time the excretion will occur. That is the transit time. When there is more amount of fiber, there is a bulk, the stool bulk is increased. So the intestinal transit time, that time from the duration we take the food and it is excreted out, is decreased. When this time is decreased, the carcinogens are not absorbed. They are excreted outside even before they turn out to be toxic. And not only that, the fiber will bind the toxins and they are excreted. They are not absorbed when there is high fiber content. So that is a protective effect. High fiber content and is a protective factor, and high fat, animal fat is a
Sorry to stop you,
uh,
sir. What is fiber?
uh, fiber. I cannot explain, Suresh. I hope it is an undigestible thing which is not digested. Fiber, I didn't have the concept about fiber. So regarding fiber, I don't know exact thing. It is so we'll check it out later. Suresh.
Okay, please go ahead, sir.
Okay. So these are the protective factors: vitamin A, vitamin C, vitamin E, ACE. These are antioxidants. Vitamin A, C, and E are the antioxidants. And normally, whenever there is an oxidative stress, whenever there are free radicals in the cell, they will cause DNA damage and the mutations will occur. But if there is a high content of these protective factors, vitamin A, vitamin C, vitamin A is beta carotene. Beta carotene is vitamin A. So when these antioxidants are there, they will neutralize the free radicals and they will inhibit the development of the cancer. So the lack of protective factors, vitamin A, vitamin C, vitamin E, is a risk factor for developing carcinoma, cancer. So finally, the conclusion is the second most common cause of death of cancer in women is breast carcinoma. The first one is lung carcinoma. The best way and the earliest diagnosis of breast carcinoma can be done by screening mammogram even before the lump is palpable by the patient itself or the clinician. The screening mammogram will pick up the breast carcinoma, and the early diagnosis will give 100% survival of the patients of breast carcinoma. And whenever the breast carcinoma is well established, a multidisciplinary approach along with surgery, radiation, or chemotherapy is done to the patient who has developed the breast carcinoma. So that's about the breast carcinoma. So I'm a bit fast, sorry for it. That will conclude. Thank you.
Great.
Yes.
Guys, I have mentioned few questions for sir. I'll just go with that. In case you have any, you can either chat or raise your hands so that we can go one by one with the questions.
Yes, yes.
Okay. Sir, I'll go with the first question. How is the late delivery, first delivery, related to cancer?
Okay. When there is a first delivery is done at an early age, when the first delivery occurs at an early age, there is a the reproductive life, estrogen is opposed by progesterone. When the first delivery occurs at an early age, the progesterone is having a protective effect over estrogen. But when the delivery time is, when the first birth occurs around 35 years of age, then there is no, sorry, I'm not able to explain that actually.
Yeah, that's it. So that's the balancing property between estrogen and progesterone. That's what you're trying
When there
to
is
tell.
yes, when there is a hormonal imbalance, they are more likely to develop breast cancer.
Get that, sir. Get that,
Yeah.
sir. So, when you said that this hormone replacement therapies, if they are given to protect the bones, the osteoporosis, then
Osteoporosis.
again it is the estrogen hormone that is enhanced, right?
Yes, after menopause, estrogen is given to prevent osteoporosis. But the research has shown that postmenopausal estrogen has increased the incidence of carcinoma of breast. So this was a finding.
Estrogen.
Yeah.
Yes, sir. So next question was, people undergo IUI or IVF treatments these days. So have we seen risk of breast cancer in that cases also?
I don't know the exact. I don't know.
Okay, so I mean the alternate pregnancy things. That's what I was asking about. So are they more prone to the risk of breast cancer?
IUI and IVF, huh?
Yes,
IUI
sir.
and IVF. No, there is no relation with IUI and IVF. There is general. It is
Oh,
general
because again,
as
that is because of the delayed thing, no? That
when
either the
there is a
pregnancy is
delayed
delayed or.
pregnancy, they are generally prone to develop breast cancer. After 35 years,
Okay,
IUI is done means that's general thing.
Okay.
As with the normal people, they are also more prone to develop breast carcinoma after 35 years, 40 years. They are more prone when there is a delayed
Right,
in the
sir.
pregnancy.
Right, sir. So next was the other areas that are under attack. So are there any particular areas that are more prone or more vulnerable to these attacks, or it can be a random any place?
Oh, the most common area where the breast carcinoma is developed is the outer and upper quadrant. That is the 70% of
No,
the
sir.
cases occur.
When they have leached out, I mean, they were restricted to the breast cancer, but
Hmm.
at stage 5, when they enter into the other organs.
Okay, the most common area is the lung and the liver, because first
Lung
one,
and
the
liver.
tumor cells will metastasize, will spread to the lymph nodes, axillary lymph nodes, because the lymph nodes will act as a filter. The lymph nodes are actually a filtering mechanism, either bacteria or tumor cells, they will filter. So from there onwards, they will enter into the blood and then they reach the lungs and the liver. After reaching the lung and the liver, they will spread to other organs. The first area is the lung and the liver. That is the preferential.
Get that.
Neelam, can we please stop the screen share?
Yes. So you can click on the share button again and that'll. Sir, I'll reclaim the host so that I'll just turn it off.
Okay, ma'am.
Yes. Thank you, ma'am. Thank you for this. Hina, a last question, then you can go ahead. So, aflatoxin that you had mentioned, is it like only in the packed foods, or is it in some existing foods also? Like some foods which are said to be more estrogen prone.
Aflatoxin is found in moldy hay. That was the thing that was given. So it was a contaminant. moldy hair. It is responsible for the hepatocellular carcinoma, liver cell carcinoma.
So thank you, thank you. My questions are
Yeah.
done. Hina, go ahead, please.
Yeah, good evening all.
Yeah.
Yes, I have a doubt like this BI-RADS 1 and 2. So it
Yeah.
is BI-RADS 1 is negative and 2 is benign. So
Ah.
what is the difference between these two? Like, if it is negative, then what exact is negative and benign is like
Negative means there is no lump
non-cancer, but
itself. There is no lump. Benign means there is some tumor which is not malignant.
okay. So
Neg-
in first place, like why we check if it is negative or just
Screening.
suspicious? Like
It is we got some doubt. We go for screening. He is not
okay,
having any lump,
okay,
but he is having some suspicion. There is something in my breast. But clinically and
okay, okay,
even
got it.
radiologically, there is no tumor. In BI-RADS 2, there is a lump in the breast.
Okay, okay, got it, sir. Thank you.
Yeah, yeah, yes. Thank you.
Guys, we have more questions.
I just want to add one point regarding aflatoxins.
Yes,
I
ma'am.
remember one of my classmate from Kashmir, she has done a research on walnuts and aflatoxins in walnuts especially.
Yeah.
Because they are more available in those regions. So when you said any other sources, I just remembered that. So I just want to add that.
Yeah. Yes.
Thank you, ma'am.
Ma'am, even cons.
Okay, great. Thank you, thank you.
Okay.
Guys, do we have more
So,
questions?
sir, I have one.
Sir.
Yes, ma'am.
Sir, I
Jyoti
have
ma'am, go
a
ahead.
question. Yeah, I'm sorry about my tone, sir. My
Yeah.
voice is gone.
Okay.
Sir, recently we are coming across so many breast cancers, right? So once they go for long-term chemotherapy, and what is the effect of the immune therapy, even though they took a lot of care in nutrition, food, and all. So maybe after 5 years, if they stop chemotherapy, is there any chance to get back cancer cells after stopping chemotherapy, following natural way? So these breast cancers may trigger again these cancerous cells to another breast or maybe the same breast, even though
Once breast cancer has developed in one breast, if there is a personal history, there is always a risk because the mutation has occurred. Because mutation is already there in that patient, there is always a risk of developing breast carcinoma in the contralateral breast or in the same breast, some other place. There may be a new breast carcinoma, not only recurrence. It may arise from another cell. Other new breast carcinoma may develop when there is a personal history of breast carcinoma.
okay, how much chances are, even though the patient recovered last 5 years, there is no sort of any symptoms and healthy, happy. So it is not, it's
Okay.
not a cure completely, or else it is completely remised. After 5 years, I'm talking about.
Yeah.
They go for again the screening. Of course, they go for every year, 6 monthly, they go for screening. Is there any chances of getting
Actually, I don't know, man.
the same kind of?
I have to refer and tell you. I will put it in the WhatsApp. I will search and I will put it. I will ask the oncopathologist or oncosurgeons and get back to you.
Sir, good evening, sir. I have one general question.
Yes.
We tend to see people, the general public, there is a craze of getting the diagnostics done very, very frequently, whether
Okay.
it is needed or not.
Okay.
In fact, there are so many people who take diagnostic memberships these days, just like gym memberships. So my question is, there are so many controversial things about mammogram getting done repeatedly, unnecessarily. So are there any negative impacts because of getting these tests done unnecessarily on the healthy tissues of the breast?
Okay. So the radiation amount of radiation exposed during the scan is very minimal. So there is no effect on the breast carcinoma.
Okay.
So only for
But
radiation, which is given for cancer treatment, for Hodgkin's lymphoma, then there is increase. For ultrasound, for this mammogram, there is no increase of developing breast cancer.
but sir, see, if we compare 2 decades earlier, 3 decades earlier, we never used to get all these tests done.
But
Yes, we are
nowadays,
comparing with radiation and other things, so it is relatively less. But when
Mm.
we compare to the days where never it happened to the days where every 6 months people are getting it done,
early diagnosis
what
is
would be
being
the
made.
impact?
Early diagnosis is
But
made, and the mastectomy is done, and the survival is increased.
so
So the
as being a
cancer is
holistic
completely
coach, sir,
curable.
okay, you
When the
finish that,
cancer
then
is
I'll put my
diagnosed
next
early,
question.
when the cancer is diagnosed early, it is 100% curable. When it is diagnosed in the 4th stage, it is fatal. 15% only develop. Only 15% will survive 5 years when it's in 4th stage. So mammography screening will is an early diagnosis and a cure. Yes, ma'am.
So see, being the holistic coaches, we are into this practice.
Mhm.
And is it not like expecting, a better screening, thinking that a better screening would help? Are we not building up the fear of actually developing the disease from the holistic perspective for repeatedly getting these tests done?
Repeatedly means after 40 years, every 1 year it should be done. Before 20 to 40 years, for every 3 years it should be done. So it's up to
So
us.
from
Whether
where did we got our norms? See, all the diagnostics, these norms are set by, again, because this has all become a different perspective of getting into the business. Because when I said people are getting diagnostic memberships like gym memberships, you get it done, you get a discount for your family. So unnecessarily the entire family will go and get the test done. So how do we treat this, and is it really needed?
So the risk increases as the age increases. Is it
Sir, I
really
am
needed?
47. I have never got my mammogram done.
Okay. So it's individual decision, man. If we are feeling any, so the first thing is we should check the breast, and we will get it. When we get it out, we'll go. Otherwise, it's not a thing.
Okay.
Yeah.
Thank you, sir.
Thank you.
Sir, good evening.
Yeah.
Sir,
Okay.
I have a doubt like when a lactating woman, if she experiences a small cyst inside her breast or milk secreting glands are unable to secrete milk at that time, is it necessary for a mother, a lactating woman to feed a baby, sir?
Yes, she
She's
should feed her
experiencing some
baby.
pain and
So
and
she should,
only one part of the breast is only affected and the other breast is okay. Doctor prescribes us that you can feed your child. If you feed your child, it is better, and might be this cyst might get removed instantly from the body. Is that myth true, sir?
yes, true, man. Yes, I have done FNSC for a galactosile. Because they didn't breastfeed, their breast have become a lump, and that blood, that thing clotted. So most of the times, the breasts are heavy. I have done FNSC. When I did the FNSC, instead of blood, I used to get milk. So then we used to suggest you breastfeed so that the ducts are opened up and that will dissolve. So when they didn't breastfeed, the milk is going to clot and it forms a lump in the breast. So breastfeeding is to be done. Otherwise, it will develop a galactosile. It will develop
Yes.
a
Thank you, sir.
sac which is filled with milk. That is galactosile.
Yes, sir. Will be filled with the system. Yeah, ma'am. Thank you, sir.
Yes, ma'am.
So guys, do we have any more questions?
Yes. Okay. Thank you,
Yeah.
guys.
Thank you so much, sir. It
Thank you
was
all.
really an insightful session.
Yes,
And
I've
thank
been
you
a
so
bit
much,
fast.
sir.
I will try to be slow next time.
No, sir, it was quite good. We have to pick up our follow-up speed.
Yes, ma'am.
Thank you, sir.
Thank you, ma'am. Thank you all.
Thank you, sir.
Thank you, sir.
Thank you. Thank you.